let's get into this. So, welcome everyone. This is the first live for Princess and the Pea, my podcast, which is very exciting, and I don't think there's anyone better to do it with than a fellow autistic ADHDer who's also a passionate disability advocate like myself. We have a lot in common, including our special interests, which is always exciting. But yeah, no, thank you, Larissa, for being here today, and I'm so excited to dive into Autistic
Thank you so much for having me, and we're both content creators too. I'm really excited about like the Shine Lucky Fitness collaboration with Princess and the Pea. But
yes, yeah, I love your YouTube channel. It's so good. Everyone needs to go on YouTube and look at Shine Lucky Penny and all her videos. They're amazing. Do you want to start off with just saying a bit about our identities? So I identify as she, her, and I hold a lot of privilege as a white cis female, and at the same time I also have marginalizations such as living in a fat body, and I say fat in a fat acceptance lens, and also being a neurodivergent, multiply disabled, both physically and neurodevelopmentally person.
So I'm also she, her, and I'm also autistic and an ADHDer, and I also have privilege as a white cis female, but I also feel like I've been marginalized to an extent because of my neurodivergencies and also my multiple disabilities and chronic illnesses. Yeah, there's so much overlap. Yeah,
they're so chronic. Yeah,
right.
So true, which is why we're here, really, because there is so much overlap. I don't actually. I know a lot of autistic people, and I don't know many autistic.
It's very common to have like. I think I read most children that are autistic have like 3 or 4 co-occurring conditions at least.
Yeah. At least.
Yeah, I don't think I've met somebody that just was autistic and that was it. At least not personally. I have not. They've always had like at least one to. Most have had like 2 or 3 at least other co-occurring. Yeah.
And also most have co-occurring neurodivergences. So there's so many autistic ADHDers. I'm also dyslexic. Many of us have multiple neurodivergencies, including, PTSD, anxiety, OCD.
Yeah, I'm dyspraxic.
There's a lot of overlap. I don't think there is a non-neurospicy.
Or DCD for the people in the US.
Yes. Yeah, definitely. But yeah, so we thought we'd start off by sort of sharing, I guess, for those who don't know our stories, if you haven't had the pleasure of listening to us drone on other platforms, on our diagnostic journey and, when we were diagnosed. And then we sort of want to talk about how our lives growing up undiagnosed were affected in healthcare settings. And then post-diagnosis, how we were still faced with many, many barriers and challenges, even with the diagnosis, which I thought when I got diagnosed that it was a life-changing thing, because I was like, finally I have context, finally I have a label that can let health professionals and everyone understand me and accept me. But that was not the case. I still would show up. I would show up in front of, my OBGYN and other specialist doctors, and when I'd tell them I was autistic, it would be like telling them that I like baseball or something. Like, so
because I've had that happen.
Matter.
Yeah.
No, you did get that, didn't you? I didn't, but I'm very forceful when I say it, because I'm like, don't even try me. But I've heard that it's really common that women are not believed when they tell healthcare providers that they're autistic. What's your experience?
I actually at one point had a doctor's note that said this is their word, so I prefer saying I'm autistic, but it said Larissa has autism spectrum disorder and ADHD, and that note did not go over well for the most part. But I also tried things before the note, but a lot of doctors kept saying I must have had it as a kid. Like they thought I magically grew out of it, which I don't even know how they think that works. It usually doesn't work like that.
Well, I think that's because No, I mean, no, it
I know.
absolutely doesn't. You once, if
Yeah.
it once we're born autistic, you're always autistic. It's an old myth
Or you were
that you
misdiagnosed
grow out
as
of autism.
autistic would be the
If anything, yeah. Well, you either misdiagnosed, or what's very common is you just learn to mask more as you grow up. So you learn to hide a lot of your autistic traits because society kind of forces us to do that from lack of acceptance. So from like a safety perspective, you just get better at trying to hide it. Some of us, not everyone has that. Not everyone has the privilege of masking. And I find that interesting. I do like to talk about that because masking is a privilege, absolutely. It gives us the capacity to have a level of
yeah.
safety that some people don't have access to. But at the same time, masking is so damaging for our mental health. And it
Well,
also comes with a lot of negatives. And
well,
so
that
masking
and
is not
honestly,
a
it's
good
so
thing.
automatic for a lot of us. It's I know you know this, but it's like it's a social survival response
Mm,
completely. And I also like using both camouflaging and masking personally because I feel like I do two different
absolutely.
things because I feel like sometimes I'm not even knowing I'm doing it, and that might be more like camouflaging, and then other times I know I'm uh not like putting on an act,
Yeah.
but I know I'm it's kind of complex to explain it, but doctors aren't
Yeah,
that
yeah.
familiar with the concept. And I think I may have been camouflaging without
No,
knowing it
that's
when I was
true.
younger. Maybe I didn't do it that well as well, but because I think sometimes,
Oh,
I don't know.
100%.
I also, this is kind of
Yeah.
funny, but I had a doctor's note. I was a little bit older, but I tried to smile and act like what I viewed was neurotypical. And I think this was before I was diagnosed with autism. And they put in the notes very odd effect. And I think they may have even said very, very odd, but it was like, I don't know. I was trying to be charming and it came off as odd. And it's like, oh, I don't know.
Yeah, you were trying to, yeah, yeah. Yeah, that's always the problem is it doesn't even always come out the way we want it to. But I think that's a really good point you raised, Larissa, because I don't think many people understand that masking it's complicated, right? Because I mean, I've been masking since like I was conscious. I remember masking as early as maybe 5, honestly, but we didn't know it was called masking. And you're not that conscious of it. It's just like an innate reaction to trying to behave appropriately and not get in trouble and stop the criticism and rejection coming. So you look around and we're people observers. So we watch the world around us and we go, okay, these people were accepted and liked for doing ABC, and so we need to do ABC. And that filters down in every setting in life, including when you go to the doctor and you present. So it's really complex, and even I don't know about you. I'm interested to hear what your experience is. But since being diagnosed 3 years ago myself and learning about masking and camouflaging and what I was doing, I find it very hard to unmask because it's so trained into me now. And I'm not always sure like it depends who I'm talking with, how safe I feel about unmasking,
Yeah.
and whether they'll be truly accepting. I know we talked about this earlier, as well. So I'm interested to
About
hear what you
when I,
found
after I was diagnosed with an adult with fasting. So I found a lot.
about
It
masking.
actually
Yeah, like,
became an interest for a while.
yeah.
So it's so hard to define for me. So at one point I was very strict with how I defined masking. It was basically
So hard.
anything that I had to be taught or that I had to not necessarily be taught, but I had to witness and observe and then figure it out. But I feel like that might be a little bit more narrow
Same.
minded than some people, or I don't know, there's different viewpoints. Like,
No, I think that's pretty
yeah.
good. I think it can be subtle though. Like it's not like it needs to be explicitly pointed out. You can literally just watch a movie, read a book, or see like your parent or someone around you doing it, and that's enough. So I think people sometimes hear that and think it means they need to be told
Yeah.
exactly what to do. That's not masking, really. I mean, that's more ABA or behavioral
Yeah,
therapy.
I
Not that
might
I
a
want to get
little
into ABA
bit
talk
because of
because
my history,
that's
though.
not great.
Oh yeah,
Oh, you can absolutely
yeah.
go. I'm happy for
Oh,
you too. I just like I get upset when
oh
I
yeah.
hear
Okay,
about it.
so
Like
oh
you
man,
talk
this is
about
like
it.
such a oh, this is just it's just difficult to
People
explain
need
it,
to hear, so
and it's something that I've been on the fence, but I don't like that I did that.
it
I
is.
have to hide this because of how the autistic community might be, or some autistic people might feel about it, because I feel like it never should have. Yeah.
That's true. Some
Offensive.
people
Well,
do
it does have
find
a
it
controversial history for a very good reason that
positive.
we're not going to get into.
Yeah.
But yeah, I mean, I can't gloss over that.
Does.
But so, I mean, it exists,
No,
and
you can't.
I'm also
You
a
can't.
consenting adult who. I mean, I feel like that's important. So I could consent to it. I could agree.
Absolutely.
And even then, my care has got like a lot better with neurodivergent behavioral therapists. So there's a world of a difference.
Mm-hmm.
I don't know. So, but yeah, it's just, it was because of the really bad, or not bad, but like the discriminatory medical care was what caused me to seek out ABA, because my insurance, at this point, I had the autism diagnosis, and insurance told me that this was the only way they would pay for someone to go back with me, because everybody was convinced that because I was autistic that I must have been doing something wrong. But it turned out it was a lot more complex than that. I feel like that's probably less common, though. Usually it doesn't come down to having ABA, but that was just my story. But I have some complex health issues going on.
Yeah. So, and I think as well, like, just to, I guess, expand on that. I like to talk about and think about like the concept behind why a lot of us don't subscribe to ABA. And it's not just ABA, it's behaviorism in general. So in my non-medical brain, I see it like ABA is just like training someone to mask. You're saying that's not a right behavior, I won't reward it, or I'll punish it. And that is a right behavior, and I'll reward it and not punish it. Sorry, wrong way around. And that's literally just forced masking. And the problem with that, and the problem with masking, but that's a more direct version, is that you're causing us trauma, and you're not allowing us to be who we inherently are. And so that is where, a lot of us late diagnosed get either diagnosed or recognize that we have like CPTSD, because living in this world where we didn't realize that we were allowed to say, no, this is actually just how I am, and if you just give me some space to be different, I will be okay, and like everything will be better. Let me stim, let me be any kind of differences. Let me self-regulate in a way that isn't normal for you.
I had to teach my ABA therapist some of these concepts about. I think they were a little bit familiar with masking, but I've talked about like a lot of different things I won't get into on here because it's beyond the scope. But autistic burnout, which definitely can look like anxiety and depression, and I really think that was kind of what happened. I think I was so burnt out from what was happening at the time, because the medical care was a whole thing. And then this had also been in context of years before that, when I had been through a lot of different things. Like I was misdiagnosed with bipolar disorder, which is very common with females and marginalized genders in general.
Very common.
BPD,
bipolar and
anxiety disorders. Really mood disorders
most common misdiagnoses. Yes, but I mean, you can have co-occurring any of these, but very commonly it's just misdiagnosed. I think that's important to mention too.
I feel like you can talk about more during the mental health episode, but there's definitely ways to tell the differences. Just so often it comes down to, at least in the U.S., doctors are pressed to have the appointment go very quickly. And I think that's where things can go kind of wrong, because sometimes it's not that I don't say I have slow processing speed, but sometimes we can process different things differently, and that can affect communication style. And I feel like when someone diagnoses someone with something like that in the first appointment, because I got the bipolar misdiagnosis when I was a teenager in the same appointment, so it was diagnosed after one appointment. But it's really common. It's a sad thing.
how long after that
It
misdiagnosis did you find
was,
out you
oh
were
man,
autistic?
I'm wanting to say it was over 10 years. It was really bad. And I was on, it was bad enough that at some point the medicines I
Wow.
was on for it was, I can't, I feel like they were causing some health problems or at least exacerbating it. And some doctors think it may have been making stuff like seizure
Hmm.
activity potentially worse. And then, which is a thing with some of the medications. And then I was also having vertigo that
Mm.
was triggered by medications. But sometimes the side effects for the
Yeah.
bipolar medications were so bad that I would go to I had to go to the hospital for something because it dropped my sodium to like, it dropped it to a dangerous level in my potassium. And I had to be hospitalized for a few days. There was some other
Oh
stuff going on, but
no.
it was that medicine side effect. And then also I had other like really bad side effects.
Yeah.
But honestly, yeah.
This
Uh,
is interesting.
yeah.
Oh no, you go.
That
Sorry.
also kind of reminded
There's a
me
lag.
because it's actually connected with another thing where I feel like with the bipolar medication for this
Yeah.
misdiagnosis, I was basically dismissed from, I want to say it felt practically like it was day one, but back when I was a teen, I said, oh, it's affecting my cognition. I feel slowed down. And the doctor said, no, you're just depressed. And I wasn't
Mm.
depressed at the time, but that's what they said. And then I found out years later it is really known
Yeah.
to cause it because it's an anti-seizure medication. It slows brain activity. That's what I was on.
Of course.
So
Yeah.
I don't know, but there's definitely that
Hmm.
history of kind of dismissing. And I
Interesting.
think it might have to do with a few things, like alexithymia might have to do with it because alexithymia can cause problems
Mm.
with identifying emotions in
Yep.
yourself and others, and also not recognizing certain
Hmm.
internal bodily sensations. But
Yeah. So I love this. You're bringing up so many amazing topics, like the medication sensitivity, like how some of us are hypo and hyper to different meds is such a big thing, and also the medical gaslighting and dismissing. But alexithymia, is so interesting. My Alexa just went off, because it links to interoception. Go away, Alexa. Alexa, stop. This is a problem with that word. But interoception, I think, is critical to talk about as well, which underpins alexithymia because, as you know, a lot of a lot of us have different sensory processing issues, and that can come up very, very seriously in terms of like pain, hypo and hypersensitivity to pain, and how we present and whether we're believed by doctors. And it can also come up in just like where we feel things in our body and being able to like know what's going on. I've always had severe anxiety from a very young age because I've had so many doctors and medical and hospital things where a doctor will say, where are you feeling that? And I'm just like, I'll be like, oh, here? Like, but it's kind of a guess because I struggle to interpret my body signals and I don't trust that. But
yeah,
it was hard to articulate as a kid. Whereas now, I understand that this is a thing, so I'm a bit more. It's
same.
easier for me to advocate for myself and say, well, I actually find it really hard to connect. So
Yeah,
yeah,
because
you've
that
so
was a
many
big
important
difference.
points.
Is when I didn't know what was going on, I couldn't really describe it. Maybe I could say I wasn't very good at something, but that doesn't always work. And then there is a tendency to be dismissed, and it may not be intentional always, but I feel like my tone of voice may have not been taken the right way, or my facial expressions, because I do have alexithymia, so I may not always change my facial expressions. I believe that's what happened
Right?
because time and time again I've been dismissed when I've said that I have a symptom or that I have a side effect from medication. And one of those that I can think of is I have really bad reactions to they're actually
Mm,
called paradoxical reactions, so it's the opposite of what the medication is intended for. So usually benzodiazepines calms people down. It does the opposite
gotcha.
of me.
That's
And like
awful.
one time, and it's kind of funny, but I was in high school and they didn't tell me that they were giving me this medication, and it was on, I thought it may have been on my allergy list, but I definitely said it ahead of surgery. And afterwards, I'm waking up and I'm freaking out. And I'm hearing some of this later on. Apparently, I thought the nurse was a monster that was going to eat my face or something crazy like that. But anyways, I don't know. It was causing hallucination, which I don't normally do, obviously. But it was from the medication, and we found out that they gave me the medication without my consent when I was asleep under general anesthesia, which is kind of messed up. And it's really messed up, actually, when you think about it. But and this isn't the first time something like this has happened. Some of the other time that I can think of was when I was having very severe vertigo, and I can't do justice how bad it was. It was very, very bad. But Valium can be used for vertigo, and I was so miserable that when I had to go to the hospital because I was so sick with vertigo that I could not keep anything down, and I was basically bedridden, they talked me into, because I felt so bad, they said, well, you have to say it's not an allergy for the benzodiazepines. Otherwise, we can't give you the medication. And as the hospital stay was happening, I kept getting more different in how I acted. Like, I would get more irritable. And then I also, over time, not only that, I started having my muscles just kind of flop. So they became floppy and I couldn't stand, which was very scary. And then at one point, the doctor told me that they were going to do a psych eval or something. And he was even talking about the psych ward. And then I found out from the nurse that without telling me or a family member, they had changed the dosage twice. So they had increased my Valium and they increased the frequency of the dose and how often they gave it to me. So they stopped that and went into damage control mode, dropped the psych eval, and then once they realized and it became very clear and everything, my behavior normalized, I could stand. It's just, I don't know. I feel like it's related though.
Oh my goodness. But, and this, like, I do think it's related, and I think it's a really important story because it is so common for many of us to experience things like this. I have a hyposensitivity to anesthetic, so does my mother, who's also autistic and ADHD and Ehlers-Danlos, and I got given, and then I have a hypersensitive to some meds. Clonidine messed me up so bad. I had the lowest dose. I got put on a muscle relaxant, very low dose, fell down my entire staircase home. The first time I took it, so having different reactions to meds is something that a lot of us do experience, and I hear it a lot from our community. We've just had a comment. Could you talk about how the concept of double empathy might affect misunderstanding and communication difficulties, also gender bias and not being believed, and perhaps possibly gaslighting, dismissiveness when reporting our own symptoms and experiences? Yeah, that's really important. So if anyone who doesn't understand, I like to explain double empathy. So double empathy is a concept. The double empathy problem was discovered like about a decade ago, but I always like to explain it where this researcher got a group of autistic people and a group of non-autistic people, and they both groups separately did kind of like Chinese whispers, where you like whisper in the air and a message goes through to the end. And then they've got a group in the middle, and they had both autistic and non-autistic. And the outcome of it was that the all non-autistic group and the all autistic group both had a very similar outcome in terms of accuracy of that message going through. But then when you got the two groups together with the mixed neurodivergent and neurotypicals, it was appalling. They did such a terrible job. And so the concept is that it's not actually autistic people who have any kind of communication deficit. It's just that we have a different type of communication. And this is a big problem in health because we're talking to people who communicate differently, and there's so much room for error in that.
Yeah.
And yeah, it's just
that was actually
such a good point, Sangi.
Not trying to bring up ABA again, but that actually really ties into it because a lot of it was I wasn't being met halfway in my communication style. Yep.
It was all on you to change. Yep. Commonly is. Yep. And gender bias is a huge one, especially for being believed and pain response. I mean, for all women and gender diverse people, not just autistic women or gender diverse people, but more so for us because we've got the added layer of communication, interoception, struggles. I like to talk about how, so I am hypersensitive to pain. So a lot of medical doctors think that I'm faking it because I'm so overly dramatic when I'm in pain and so overstimulated, so overwhelmed. And then my cousin, who's an autistic accountant, and I'm an autistic lawyer, she is hypo. So she's had equally traumatic experiences with doctors for not believing she has anything wrong with her, including being sent home with internal bleeding from a bike accident because they didn't want to do any scans because she didn't look like she was in enough pain, being sent home from hospital when she was ready to deliver her second child because she didn't have a sweaty upper lip, and the midwife was like, no, sweetie, you're going to be a while, go home. She started to leave. This was before she realized she was autistic, and then came back and literally had the baby in 5 minutes. So like we have such different responses to these things. And the other thing I wanted to talk about that you mentioned was facial expressions, right? And yeah, that's a big one. And I think I don't like the term flat affect, but
sometimes
some of us, it's also inaccurate. But I tend to be quite like flat in my facial expressions unless I'm consciously trying. So right now I can see myself, and so it's like triggering me to be more expressive. And when I'm talking to anyone and I can't see myself, I put that on too. That's masking. But when I talk to, like, say, my husband, who I don't have to do that with because I know he just understands it, I can absolutely just be very like non-expressive, and that can be so misinterpreted by neurotypicals, and that really plays into the clinician-patient relationship of them making judgment calls on how we're experiencing things when we're not reacting the way they expect.
Yeah, and I've actually been told before that my facial expression was not reflecting that I was in pain. So,
exactly. So that's like my cousin. She doesn't look like she's in pain, and she kind of isn't. Some of us are in pain and don't look like we are, but she genuinely was hypersensitive
I have
to pain.
both. It really depends on the type of pain. I suspect I've had both in some ways, but then I can definitely relate to what you're saying where doctors didn't think I would be in that much pain, but then some of it also had a bit of a gender bias because I had a doctor tell me that endometriosis could be causing pain, and it's known as being painful. Some women will have it and they won't feel pain. They might have other problems instead, but it is definitely not unheard of for it to cause pain. And for those that don't know, it causes the endometrial lining to go outside of the uterus in different parts, and it can be very painful, especially around your period. So, but yeah, and like one doctor told me that because his wife didn't have pain from it, I couldn't be having pain from it. And that doesn't make sense.
That's just like saying you can't be autistic because my friend's 7-year-old is autistic and he likes trains. Like, yeah, it's so ignorant. It's so ignorant, and it's so common. It's so common for these doctors to have unchecked implicit bias. I mean, there's so many that are really good at, one, acknowledging what they don't know, and two, holding back their implicit bias or at least being aware of it. But sadly, they are the minority, and that's the problem. And on top of that, we are autistic women and gender diverse people are so misdiagnosed, undiagnosed, that we've got this added layer of not being able to advocate or understand ourselves in a way that we can translate that to health professionals. And that it's such a huge challenge, but the gender bias is absolutely real. And the other thing you mentioned with endometriosis, I have PCOS, polycystic ovarian syndrome, but hormonal stuff, hormonal issues are a very common thing, and they're only just starting to be researched, right? Like in the last 5 to 10 years of hormones in autistic and ADHDers. And yet I know so many of us, and some of the stats coming out around, we experience PMDD, post-menstrual something disorder.
I know what you're referring to, though. It can cause moodiness I can't remember what around periods and stuff.
Yeah, PMDD, PCOS, endometriosis. Yeah, there's so many hormonal issues that many of us experience. And I think the important thing about this is that we're much more likely to be going to healthcare settings. We're much more likely to need healthcare support, intervention, whatever you want to call it. And so, I think it's critical for all health professionals, whether you're a doctor, specialist, or allied health professional like an occupational therapist, all of them need to be educated on actually understanding the internal autistic experience and how that can affect how they treat us, how they see us, how they
Yeah.
interpret us, and how they judge us. Because a lot of
Oh,
this is coming down to judgment, right? Is the inaccurate
definitely.
interpretation
And
of our behavior.
oh man, there's just a lot of different judgment that happens. And I also feel like sometimes has been like a lose-lose situation. At least it used to be, because I was judged if
Yeah.
I didn't react. Because then they say there's actually a phrase for it. And it's like love ballet indifference, something like that. And yeah, it's just that's
Yeah,
the
you
other
said that.
thing.
Yeah.
Apparently, okay, okay.
What does
So
that
I think
mean?
it's
Can you
more
explain
common
that?
with
Because I actually don't know what that means.
I'm going to use some older terminology with like conversion, and I think now it's somatic symptom disorder, but they used to have like somatoform disorder. So I'm using some slightly outdated terminology, but basically it can cause someone to not seem
Mm-hmm.
concerned like about their medical reaction, and this is interpreted in a couple different ways. And one interpretation that doctors used to be taught was that they were taught that this is a sign that it could be psych, and especially in females. And it was, and I actually found a
Absolutely.
document a while back, or I found multiple documents, and many autistic behaviors or neurodivergent behaviors were actually on the list of stuff to look for psychological causes of medical conditions, and that's just our baseline. So it's very oh man, problematic, I think is the right word here. But because also reading in a list of symptoms, so many of us have executive function challenges, and we may need to have a list ahead. So because I need to do this so I can focus and keep my communication concise. And it helps me remember the details, because often by the time I get past the very overstimulating waiting room, it's that my anxiety might be ramped up, and then it's just hard to remember. But that's literally one thing, as they say, to look for women that on a list of symptoms. Or
yeah, but then they treat us like we're hypochondriacs or dramatic, you know, when all we're trying to do is compensate for a challenge that we have. I don't know about you, but I do the same thing. And one of the reasons I do it is because I'm worried that if that I'm not interpreting like my symptoms properly, whether that's like gut pain or whatever it is. And two, that if I don't tell them everything, even if it's not always correctly interpreted, they're going to not be able to diagnose me right, because I've got this history of being misdiagnosed with things and missed. You know, like I had appendicitis when I was about 9, and they didn't think it was appendicitis, and they couldn't see the appendix behind my bowel, which is common. And my pain was in the wrong spot. So they thought it was either gallstones or just tummy upset and sent me home. And then luckily I went back because it didn't relieve. And they still didn't believe me, but my mum was very forceful. She's a nurse, so she was like, "You're gonna do this," and it was about to explode, not explode, but burst. So lucky they did. And again, this is just because I'm not presenting typically, that they don't believe.
But that's so common, because the way that we perceive sensations, our bodily sensations, is just different, and explaining that
it's so different.
Does not help that much, to be honest, because I've tried explaining that. Because if you compare me to someone that's not autistic and not an ADHD, I don't think that's quite fair or accurate or even helpful.
Yeah.
And I can relate to a lot of what you're saying.
Yeah, no,
and
I feel
like a lot of women do.
Yeah, or even absolutely, or a man common. Or any like it's like medicine is like really behind in including diversity and intersectionality in all areas. Like we're all getting compared against this like typical, white cis male. They don't even have fat cadavers. They only do medical procedures on normal sized cadavers. So the bias alone in treating larger bodies is just like, and this is in all aspects of intersectionality. Like this is just an example of one, but it's such a broad issue that I think medicine is slowly starting to realize and catch up with.
Yeah, and there's discrimination with that too.
Like,
I think studies showed that there is discrimination with obese patients and marginalized. I think it was basically every marginalized person
100%.
in general, races and LGBT plus.
Yeah.
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 It was just
the
a
O
lot.
word.
Or
Yeah. There's so many problems with it. Absolutely. But the other thing with executive function, something that is commonly talked about, which is important and I struggle with, is executive functioning around, remembering to take medication or needing to book an appointment or needing to pay for a medical bill. That's all very important and real struggles. But executive function is really complex and much more like it can affect communication as well, in terms of if I'm sitting in front of a doctor with a health problem and trying to communicate what that problem is, you've got working memory, which is why we were talking about writing the lists. You've got ability to focus on what they're saying and interpreting that and the different processing stuff. There's so many different layers to how executive function also affects communication and our ability to answer doctors correctly or how they want, and then add the communication differences on top of that, where, for instance, a lot of doctors will say, like, what's wrong with you? And it's such an open question that we're just like, where do we start? Whereas, I like it when doctors go like, what, where are you feeling the pain, or how long has it been happening? More explicit questions, or even better, saying an example of I'm sort of trying to find out, like explaining what they want, because if you explain what you want from a question, I'm much more likely to interpret it in a way that helps both of us and gets to the point.
Yeah.
But that's so rare. One, that they're doing all these open questions. Two, that they're not.
Right.
Like, it's
I
not,
totally agree. And one question at a time. And also,
yeah, you go.
I'm glad I accidentally interrupted you, because that's another thing that does not always go over well with doctors. It is a neurodivergent. I mean, it's also a human behavior, but anything neurodivergent is human behavior anyway. But it just doesn't go well. And then also disagreeing with doctors does not go well. But yeah, that's a whole thing though. But
yeah.
I actually about the executive function before you forget, because of executive function. That I feel like it would help if doctors gave patients an option. So if there is something complex and I have to make a decision like right on the spot, or I have to agree to something, I would personally find it helpful if a doctor asked me, would it help if I went and saw a patient and then came back to you? Or if they allowed me to communicate it later. Yeah. They don't always like that. And then sometimes I've tried booking 2 appointments kind of close together, which can be very hard to do with specialists, but that's been like one approach is try to. Yeah, that's true.
Not to mention expensive.
And also, it's kind of ironic that autistic people have a really appalling unemployment rate. So we also might have trouble getting health insurance. Because not everybody qualifies for benefits.
Yes. Remembering to pay bills.
I mean,
absolutely.
There's a lot of layers there.
Why that's a problem.
But I feel like doctors aren't trained enough.
Absolutely.
It just really meeting us halfway would help, in my opinion. And then also, in general, it's better for doctors not to use idioms, because that would also be more culturally friendly anyway. And then not everybody gets metaphors.
Yes, so true.
I don't know. And I've had doctors make jokes, which doesn't always seem necessarily appropriate. And I've had doctors use sarcasm, and I didn't know it was sarcasm.
No, neither.
But
yes. Yeah. So bad. What about I know we were talking about this a bit earlier, but I guess it links into the whole the not what they do know and not being able to disagree with a doctor and that sort of thing. But I experienced so I started to suspect I had Ehlers-Danlos syndrome before I found out I was autistic. And I had been seeing a couple of rheumatologists over the few years of that time, and none of them believed me. One blatantly refused to acknowledge it. The other one said that my skin wasn't stretchy enough. And another one said that I wasn't hypermobile enough, which is not true because I meet the Baton score. But because I couldn't do one of them, they were like, no, you have to do all of them. I'm like, and this is like, I've slowly over the years religiously started to research everything because, which is even worse because then doctors get like defensive and think that
they don't like that.
know it all or because I've just had so many that are incompetent.
I can relate to
I've
that.
had so many good ones too, but I've had so many arrogant ones that, and the one who said that I didn't have stretchy enough skin had no experience of working with Ehlers-Danlos and didn't even know that there was like 14 types of Ehlers-Danlos. And when I finally found a rheumatologist that specialized in it, she's like, you're one of the easiest people to diagnose with HEDS, honestly. And your history it's obvious. You have it, looking at you, assessing you fully. I just don't understand how any of these rheumatologists have said otherwise. I'm like, this happens in every specialty. You've got psychiatrists saying you can't be autistic or you can't have ADHD because you're married or you can make eye contact or you have a degree. Like, it's just like, can you just all acknowledge what your specialties are and that you don't know everything? Because I trust a doctor that does that far more than a doctor who's going to just claim to be an expert and then misguide me because I am different and they won't acknowledge that.
No, I could definitely relate. And then, oh man, that also reminded me about ABA because their excuse for my insurance denied ABA at first because I couldn't afford it without insurance covering it. And the reason was because I was married and and had a history of a job. And I also went to college. And that was like the bar. And it came down to basically I couldn't be over the age of 25. It's because those were the only ways I could have had insurance was I had to either have a job, be married, and because in order to be under your parent, you'd have to be under age 25. So so I was very vocal about that, which I think helped. But anyways, back to what. Because you also said a lot of.
No, I remember reading.
You said a lot of things that I'm just trying to unpack it all because I feel like everything you're saying, I can just really relate to it. Maybe not the exact diagnosis, absolutely. But even the hypermobile joints. So I don't have a diagnosis for that, but doctors acknowledge it. And
this is what gets me because I'm the same. I've seen like 100 physios in my lifetime, and everyone will acknowledge that I have hypermobility, but no one ever questioned, could it be hypermobile Ehlers-Danlos? Not that I'm saying you have it, but I'm saying like, this is a problem. I had clear signs and I had so many different things happen from, breaking my foot from hyperextending it. I broke a bone in my foot because it hyperextended in a race when I was a kid. And I had to stop figure skating because I got Osgood-Schlatters in my right knee, which is also really common with HEDS. And none of these things were ever investigated or questioned. Sorry, I didn't mean to cut you off.
Which is another thing that can happen with doctors' women is I can kind of lose, not my train of thought, but it can be kind of hard sometimes as a neurodivergent individual to kind of gather my thoughts, and sometimes I need to process, and that's been misinterpreted. I think sometimes doctors think I might be trying to I don't know, in the past it feels, and I'm speculating, but I think they're thinking that if I had a symptom, I would just be able to spout it out in a very concise, matter-of-fact way. And I've actually, I actually had a doctor withhold, and it's hard to explain how it happened, a paper that I'd brought in trying to describe my history and my symptoms, as well as my questions, and she literally took the paper from me and wanted me to say things from the list. And it was really, really not okay. You have? Oh, it's not
I've had that
cool at
happen
all,
at work.
but...
It's not fun. And usually we don't write those papers for them. It's for us to remind us what to say. So it's also like kind of
it is.
Like it's stepping over a boundary, right? Like, did she say, do you mind if I have that?
It's not the first time a doctor had wanted me to say it.
Or at least
I think they weren't thinking that I wrote down the list. And because they would say they wanted to hear it from me, but I wrote that. So it was literally from me. I don't.
Yeah, exactly.
And like also, I think it's important to acknowledge that some autistic people do communicate differently. So not everybody speaks out loud, but also even some of those like myself that do speak out loud, I have a fairly large discrepancy. It may be more narrow now, but I can say a lot more when I'm using written language versus when I'm speaking out loud. So when I'm being told I can't communicate in a way that, is the way that I communicate my best, it's really doing me a disservice, I feel like. And you said you do too? Right?
And also the misinterpretation. Yeah, absolutely. I'm dyslexic and I still prefer to write than speak. It's a really big problem. And also I've lost my train of thought. This happens all the time. And actually
Right.
I do want to mention anxiety here, because I think people need to realize that because we have experienced so many negative interactions, a lot of us do have anxiety. And as if any of you are health professionals would already understand, when the fight or flight kicks in, your executive function capacity gets smaller. So if you've already got executive functioning differences and then you're also anxious, it's so much harder. And I don't know about you, but I've had many experiences where I'll go into a doctor's appointment, and the first I guess judgment I get is usually, basically, in a nutshell, I was in a car crash when I was 23, and so I spent about 5 years before I found out I was autistic, having lots of surgeries, seeing lots of doctors for lots of things. And it was really interesting because I'd go in to a new specialist and they'd be very sort of judgy and standoffish of me at first. And I usually looked, I mean, I'm not wearing makeup or anything now. Like I look like this, but like worse, because I was like in a lot of pain usually. And also like my health is average right now. It was terrible back then. So I get this initial not great response, and then I'd start speaking, and I'm quite articulate, and I'm a lawyer, which I usually drop that bomb just to make them like treat me like I have a brain, which is the most up thing. You shouldn't have to prove that to have basic respect for anyone. But then they treat me so much better when they realize that I'm switched on. It's like, oh, you're a fat person, you must be stupid. And then on top of that, it almost takes a step back, because at some point in my discussion, I will have challenges, whether it's I've lost my train of thought or I've misinterpreted a question and they've thought, well, how could you possibly misinterpret something so simple? Or, all these little things that then turn it back to being judgy of me, cagey of me, not making me feel safe, and we need to feel psychologically safe in front of healthcare providers to feel like we can be genuine and that we can unmask and that we can actually like get to a point where we can communicate what help we need.
There are, and
like there's just so many
I know you
layers
mentioned this earlier,
right?
but this is also common with women and marginalized genders in general, because especially with complex chronic illness. It's something you said a little while ago that I know with my ADHD brain processing is that it's not uncommon for people to become experts, especially I feel like for some people are autistic like myself. I'm able to become interested in certain things and
hyper-focus.
Sometimes if I had to, I could make certain research things, certain topics I would kind of, it's hard to explain, but I would build them into my special interests. And also, when you think about it, doctors are generalists. So even specialists are generalists, unless I've met two exceptions, and those were doctors that were at clinics specifically for a genetic syndrome. So I've met two different doctors that specifically geared mostly towards two different genetic syndromes, but that's an unusual case. Usually they're generalists, and then when you're Googling, or not Googling, but because I only looked at reputable places online, but once you read studies on a disease after a while, it just becomes, what you learn is different than what a journalist would know. And I've heard that a lot. I don't know if you've heard that from other people, whether they're autistic or not. It's a common issue.
Me too. I have many. Yeah, I think it's even more so for us because, one, again, we get to a point, a lot of us, where we just don't feel like we can trust health professionals. So we are almost forced to become experts. And also, because I think this can be said for neurotypicals as well who have chronic health. Like most of them, there's a meme I love that's always like, it's of like a doctor saying, oh, you go in and you've got this chronic health problem, and they're like, oh, just sleep or something. Moose, my dog is getting comfortable. Sorry. You go in and they're like, oh, just go sleep more or something, and they're just like, okay, so your 1 hour lecture at med school is gonna trump my like 20 years lived experience with this. I know that that's a bit simplifying, but it is important to know that like we have lived with this our whole lives, whether we've had a label or not. And they probably have a lot of very stereotyped knowledge. Limitations.
They want
in their
textbook
knowledge,
presentations
that can really
of
impact
everything.
that.
I'm exaggerating a little bit, but not as much as I would like.
Yeah. I mean, we're being hyperbolic, but it's also very real.
I don't know. It feels like humans are humans, so we're not going to be perfect textbook cases. That's just how life is. And then,
yeah, and the more
yes,
you
and
are,
even my
dyspraxia
or developmental coordination disorder can interact, and that's another type of neurodivergency. But it can definitely interact with how I react or how my movements are on exam, and that can be misinterpreted. And then I think you mentioned earlier, my time to process sensations during a sensory exam or just an exam in general, that can be misinterpreted. And then doctors are running to explain that's my interoception problems when it is explained. I already know why, but it's not something that doctors think of being connected. A lot of them don't even know about alexithymia. I'm finding out. Or that 50% of autistic people have it. It's just, I don't think doctors are taught enough.
Yep. No.
Yeah,
and
that's
it is
true.
hard. Like, I know we're being very critical, but obviously, I mean, there's limitations in terms of, ability to know everything and education and such. There's definitely some very real barriers, but I guess what we're kind of in the middle here going like, we understand why this is happening, but we also understand that it needs to change. And we're in a world right now where, we've got the internet and a lot's gone online since COVID. I mean, COVID's horrible, right? But there are things that have helped the disabled community.
Yes.
Like being able to work from home more because it's becoming not an odd, weird out of the box thing. And, doing telehealth, which is a huge help for many of us. I would always opt for telehealth because leaving my house is very stressful from a sensory overwhelm point of view. And, taking all the spoons that I have, limited spoons I have, which affects the rest of my life. So
and it can help.
I can do it, but at a cost.
I like the virtual option myself since there's certain sensory sensitivities or low tolerances that it's just hard to accommodate for, like senses one. I don't have that personally, but I know that's a common challenge that people have.
Oh, that's definitely for me a big one. But even like executive function and like time blindness, so getting to an appointment on time, knowing where to park, where to go, who to talk to, having to do social interactions with like receptionists. There's just so many layers of discomfort for us and difficulty that is all taken away by telehealth. So good. Oh, I can't hear you.
Oh, oops, I actually muted myself. Can you hear me now?
Oh, I think I can hear you.
Hey, cool. I don't know when it cut out.
Yeah.
But
no, that's okay.
Okay.
Like,
so that's something that is a quick, or it's a simple fix to me. I feel like it's something where people are organizing appointments or the front desk or office managers could be taught. I know people talk about universal design a lot, but I really do think it's the way. It's only my opinion, but I feel like it would make things a lot more simple for multiple people, and it's not diagnosis independent or dependent. So I prefer it that way, and simply making this type of information available could really help multiple people because there's a lot of different reasons why someone may need to know what to expect ahead or may not know where to go or who to greet or how to check in. And
Yeah.
I kind of feel
Yep.
like doctors should include this information, or it's not doctors, but on their websites. I feel like it should be easily available for everyone. Yeah, accessible.
Yeah.
That's the word.
Accessible.
I feel like that's kind of the key
Absolutely.
for most of what
Absolutely.
we're
Yeah. No,
saying.
and I agree. Yeah, exactly. I think I love universal design, the concept, and I absolutely think it's not as hard as people can make it out to be, in all settings, like employment, education, everything. But healthcare specifically, it is a big one. It's the thing I think about is, I've been a large consumer of healthcare services my whole life. And for 28 years of that, I did not have any of these labels, and I did not have the I didn't have the education to articulate a lot of the things that I mostly was aware of to an extent, but didn't realize, one, that they were normal or different, or how that impacted all of these things. Like you and I are talking here after years of research and advocacy work and talking to our community and specialists. Like most of I like to remember sometimes that we are not the norm in terms of, even I speak to so many women who are diagnosed late, and it's so overwhelming because they're like, first of all, it's in the medical model, which is super pathologizing, focused purely on deficits and how wrong they are. But then on top of that, they're like, so what does this mean? And because when they go to doctors after that and say, I'm autistic or I have autism, quote unquote, doctors don't know what to do with it, and still no one has the training or knowledge to be able to accommodate and create accessible healthcare. And I like to think about the fact that, when I was that 22-year-old, 23-year-old rocking up to all these specialist appointments and GP, like general practitioners and allied health professionals, and I didn't know all these things, universal design would have been really helpful, because it would have helped all the things that I already struggle with and just didn't know how to say that I struggle with them or what I needed to fix it.
Autism in particular is treated a little bit differently, especially asking for an accommodation. I don't know the laws in Australia, but in the US we have the ADA, Americans with Disability Act, and we are able to request accommodations for healthcare. But when I've had some challenges when I mentioned autism before, but if I was asking for the exact same accommodation for a different reason, I have no doubt that they would say yes. So if I was asking for it for a different communication problem, I know they would do this, but it's just, I kind of feel like they should allow for people to have some of these accommodations, and most of them are free to like low to minimal costs. It's not the case for everyone, but it feels like there's a fair amount that I can say are free, and some of them are as simple as just some of them are just like
absolutely majority
what
of
they
them.
say from with their words could be adjusted just a little bit.
And can you imagine like how many people they'd help beyond autistic people? They're people from other cultures, different languages, different, like there's so many things that it would help, not just autistic people. And this is where like the universal design thing comes in, and how it's not like, and I like to point out, because it's like, this isn't just for our autistic community, which should be enough, by the way. It's
That's
actually
so true.
for everyone, because so many people would benefit from these simple changes and simple accommodations.
Because
and
healthcare for people who have complex health problems or multiple chronic illness, whether you're autistic or not, and I know we've sort of said this already, but it's just full of challenges. And I'm backtracking a little bit, but I feel like it's really important, if that's okay. So when, yes.
Yeah, no, absolutely.
Yeah.
Oh, I go all over the place. Where ADHD is.
Oh, yeah. Like, which, of course, also doctors love to document.
No, go for it.
No. But
yes. Yeah. Oh, do you do the thing where you're like going through the list of questions with them, and then like something will come to you about one of the first questions, and you'll say that, but they're like down here, and that they get annoyed by that?
Oh, man.
Like,
and that's just and that's something that studies will show can affect communication. it would. Oh, I see. There's a question. Okay, so
Yeah. Do you think the
yeah.
reason stigma attached, I'm just reading it for the listeners. Do you think the reason stigma attached to ASD or autism, denial of accommodations,
So
but not other conditions?
that's a good question, and I can't speak for other conditions per se, but I have had. I have to think about because I don't. It seems like it's specific to like mental health and ASD
Do you want me
and
to?
others neurodivergent. And you're welcome to jump in, but
Yeah.
my
Yeah.
understanding is okay.
Yeah,
But
yeah.
there's
So
a
I
bit of
have
a
a lot of thoughts on this.
discrimination though, or not bit. Like it's
No,
okay.
you
So
go, you go.
I'm doing this thing, which is again,
Yeah.
this is actually a good example of a coping strategy. Is I will minimize things. Um,
Yeah.
yeah, so it's not a little bit of a problem.
Minimizing,
It's a
yes.
major problem with
Mm-hmm.
how people with that are diagnosed with mental health conditions, which I know in the US we separate it from neurodivergency, and then I think it might be different. Yeah, it is slowly
I think
changing.
that's slowly
And what were
changing.
you?
Yeah.
Oh,
It kind of depends. I think. No, you go.
yeah,
I think the more woke areas all around the world are starting to recognize that
right.
neurodivergence isn't just neurodevelopmental disorders.
Traumatic brain injuries.
It's
Yeah,
acquired brain, exactly. It's mental health. It's all of it. And so my thinking around this is basically that. And you were saying this before around like how it's hard to get accommodations is I think about it like physical versus invisible disability. And physical things are so tangible. So if I'm in a wheelchair and I say, I need access to your building, you need and you've only got stairs, they're obviously going to say, well, I mean, one, I'm pretty sure that's legal these days, but they're going to put in like an elevator, an escalator, whatever, for you to be able to get up. That's just so obvious. They don't have to say, I'm in a wheelchair because A, B, C,
right.
D, and please believe me. They're just in a wheelchair and it's inherently believed. We're questioned on every little thing that we
Yes,
experience, how we perceive the world, how we interact with the world. And all of these things are so subtle, but also so misunderstood in terms of what's a mental health thing, what's our like cognitive wiring, and all these things.
right.
And this comes into the whole gaslighting, medical gaslighting, and not being believed as well, because so much of that is based on whether they think we understand ourselves and whatever they've been taught, which, by the way, the autism diagnostic criteria, not only is it based on white cis male, men or children as well, it's also very much an external presentation. And I think the ICD-11's now acknowledging this with masking, but so many of those criteria are quite hard to see, especially in women who are high masking, because we learn to suppress it and we learn to hide it for multiple reasons. And if that's the case, and we're coming and saying we're autistic, one, they may not believe us because their knowledge of autism is so limited from whatever their training is, or two, they're like, well, it's not that bad, which is why the autistic community tends to be very against functioning labels, because I would be labeled high functioning, and yet no one knows besides me and my husband what my actual functioning capacity is. And it's also a really uncomfortable way to look at it. It's a very capitalist view of what value we hold to society and function. And it goes both ways. It hurts people at both ends, because it underestimates the capacity, quote unquote, of
definitely,
more,
and
quote
it's
unquote,
way more
low functioning
complicated
autistic people,
too.
but it also puts so much more pressure on those who are, quote unquote, high functioning, in terms of not acknowledging our true struggles and differences.
Was that brief? Did you have anything else you want to say? I kind of interrupted again. No, because it also can affect adaptive function.
No, you didn't.
Which is can help with daily activities, and it can encompass a whole lot of different things, but it's just so complex, and doctors will put, it sounds like you've had doctors put high functioning. I've also had doctors correct me on that. If I say I'm autistic, that hasn't gone over well. So usually I will just make things easier, say I have autism spectrum disorder with doctors, because it's not worth it. Yeah,
because that's the language they know.
If a friend corrected me, that would be a little different. But if it's a professional, I'll let it go.
Yeah.
But it looks like we have another question. But one thing I did notice with invisible disabilities, and this is something that I experience, is they're more likely to falsely they're falsely think that is caused by psychological problems, and there's no shame to that, because that's also, stress is not easy to separate these things. I feel like it's interconnected, but I feel like doctors are very quick to label, especially females, with psychological causes. And then if it's invisible disabilities or invisible chronic illnesses that they cannot see and they don't get that visual cue, there's a tendency to put psych. So this is something that never should have happened with me, but I literally had to read a doctor's note from my psychiatrist and my therapist saying that they were taking care of my mental health, because I had already had a clean, because I was given enough trouble that I actually sought out a psych evaluation on my own, and that came out as basically I'm autistic with ADHD, which we already knew at that point. But that was basically that was actually it. Yeah. Not basically, that was it. And there was no surprises there. And I had to actually have this note. And of course that doesn't, reading a note that says it's not this doesn't always go over well. So it's just a very much of a lose-lose situation. But also the other thing that happened, because unfortunately the reason why I'm getting doctors to believe me now, some of it because now there's not a question, but there's more of a visual cue on exam. So I have objective muscle weakness now, because I have muscle disease, and I have a mitochondrial disorder, which mitochondrial is the powerhouse of your cells. So it affects a lot of different things, but that's what the testing is showing so far. That's what I've been told that it is. But until it got to a certain point, I feel like it was very easy for doctors to dismiss it. And also, I think I've heard this is common. They also said, oh, I just needed to exercise. And this was actually not, with some of the stuff that was going on, I started showing signs of like muscle breakdown and some other serious problems because of my, underlying condition. Yeah. It's just very, I don't know. It's just stuff I hear all the time. And I don't know. Have you met? I think you're saying, have you met an autistic female that has complex health problems or multiple chronic illness that has not experienced healthcare discrimination or been told that it was psych at one point? Because I personally have not met a single one.
Never. And I mean, maybe I have a slight confirmation bias because
that's true
of the work that I do and the people that reach out to me, but truly never. I've never ever met an autistic woman or gender diverse person that hasn't got some form of medical trauma. And to the point where I have so many reaching out saying things like that they avoid, and we have a 20 plus year less life expectancy, and I think a lot of that actually comes down to the fact that we don't get our healthcare needs met and are so misunderstood and not accepted in the community. And so I get a lot of people saying like that they don't want to go to the emergency department when they're unwell because they are so terrified of having to deal with all of this stuff again. That type of thing happens so often. We will all avoid getting care, and to the extent that some things that might have needed a quick fix become so huge that it is almost unfixable or causes so much harm, but just because we were so scared to approach doctors. And I think that's like the basis of why this needs to change, is that if we continue to traumatize our autistic community in health settings, then they're going to continue to have very poor health outcomes it's going to affect everything, including the economy and their capacity to work, live, exist, contribute, and
right.
all of those things. It's like
And
a ripple
sometimes,
effect.
I'm glad you brought up
Yeah,
poor health outcomes,
crazy.
because some of these things are treatable or at least manageable. And so POTS is very common, and that's postural orthostatic tachycardia syndrome. So blood pressure can drop when you
Yeah, it
stand,
is.
or
Yep. I have
also
POTS.
the
Yep.
heart rate can increase. Yeah, I have
Or
that.
dysautonomia.
So,
Yep.
but I knew I had POTS before the diagnosis. I made the mistake of reading it up. So a doctor said, "Oh, yeah." He did the test when I was lying down and standing, and he said he could make a case for me having POTS, but then he didn't actually diagnose it. It took years later for it was actually a kidney doctor who had me tested for POTS. But
oh my goodness.
But that was something that I have ways
to
to help with that, and ways to manage the symptoms. There's some people have medication, and there's also like compression leggings, there's diet, there's like a lot of different things, and there's ways to manage it and stay out of heat, and it's
so
important to know. And then also other stuff can even cause damage, because I recently found out I have an autoimmune condition that causes inflammation in my spine, and that explains why I get pain when I'm sitting. But also over time, the doctor said it could cause damage, but it took a few years for me to, it took quite a while for me to get a diagnosis, and I had to push for that. And I think, I've heard this a lot.
Yeah, I bet. I'm sorry. Yeah. Absolutely. No, I agree. It's such a big problem, and it goes into the whole, not only the medical trauma, but, our interoception issues and not being able to communicate things, not being believed when we do. There's so many reasons why we get delayed diagnoses for physical conditions as well, and lack of support in any kind of healthcare setting.
That's true. And doctors don't know these are common, or that they have a higher co-occurring rate. So POTS is a lot of the things that you're naming, even the autoimmune condition that I can't pronounce, but when I looked it up before, I think I did read that it looked like it's at least associated with autism, which isn't, unexpected with autoimmune, that type of thing anyway. But
so there's so many health conditions that are more commonly co-occurring in autistic people, and I think that's very much not
at all
well known in the health profession. And so I like, I'm a big fan of, she's actually a US doctor, Dr. Mel Hauser, who is the founder of All Brains Belong, which is a new not-for-profit that's trying to fix this problem, which is, connecting the dots. And really, she calls it all the things. Autistic people have all the things. And it's not saying that we have all the things. It's saying that we commonly come and show up in this world with a bunch of things that are quite interconnected. So things like Ehlers-Danlos loss or hormones, or like you said, the inflammation stuff, they're very common. So it's almost, to me, in my mind, I think that it's something where this needs to be taught at med school, and also like the professionals that treat all of these things, or even primary health doctors, should be aware of these connections, and they should be saying things like, oh, okay, I think you have POTS. Maybe we should see if you're autistic, because I think that would go a long way in helping, especially late diagnosed people. And we all know, I mean, you and I know how important it is to get a diagnosis.
That's
not even a diagnosis, identification, right? Self-diagnosis is, I think, valid. But because getting the knowledge that you're autistic, whether that's just figuring it out yourself, getting a diagnosis, whatever, it is such a big thing in terms of giving you the ability to understand yourself, to articulate your needs, to set healthy boundaries, to protect yourself from trauma to an extent. It's not a fix-all, and there are problems that come with it, but not having that diagnosis can cause
and I'm sure I know we'll talk about this more during the mental health episode, because there are so many,
we definitely will,
so many features that I had. And alexithymia, honestly, when a patient says that they're not depressed and keep in mind that doctors literally put in the records, I'm saying literally off for some reason, but they put in the records that I didn't change facial expression, so that was why they said I was depressed. And that's not a good reason to diagnose someone with depression.
Again,
and I'm also not trying to be too negative or say that all my experiences have been bad, because I have met some doctors that
no, of course not. True. But we are here to highlight the bad ones, and to try and make people aware of them.
One of the things I noticed, because I've had I'm obviously not a kid, right? But I have a couple doctors that are also pediatric because of their specialty. So one was like, So
because most.
So like my neuro-ophthalmologist,
I didn't mean to cut you off.
It was wonderful, by the way. She is used to being around people with that are autistic, and she understood how to examine me and how to talk to me. But it's also because
amazing. Can you tell us some of the things that she did that helped? Like,
so some of the things that she did is she really one is very simple. She listened, and she looked at what I brought in.
Amazing.
So she actually took the time to read, and this is very helpful. She requested the records ahead, which is huge, because being able to read the records ahead on a complex medical patient can really help, because otherwise the doctor is cramming pages of records during the appointment,
and it's on you to make sure that they've read them or if you the pressure's put on the patient because usually they do just skim them. I mean, doctors are so limited with time and such, and our records are usually quite large,
right? And
because of our complex health.
I did have a little bit of help now that I'm recalling, but I think based on my other experiences with this doctor, I don't think it was all on this, but something else that helped was I had a doctor that was sort of he was an advocate at that point. So he wrote a letter and he referred me to her, and he also wanted her to specifically go down my symptom list. So I don't know if that was part of why, because I feel like that's not the full reason, because at other appointments she's been very careful to look at everything that I bring in, and she also doesn't get annoyed if I ask questions, because my flavor of autism, I ask a lot of questions. It's how I learn and understand, and she is fine with that. So that's another simple free it's not even really accommodation, but it's just having patience. But
well, I mean, it is having patience and letting, I mean, because some doctors don't see why. Maybe you'll ask a question that they don't think is relevant or not important to go into, but it's relevant to us to get a full picture, to know, to answer the questions we have, to lessen our anxiety. There's so many reasons why answering any questions is so accommodating.
She's one of those ones that usually at some point she will leave the room to see a different patient, but this actually allows me to process things. So that's another thing that she does that I find helpful. And then she also, if I catch a miscommunication, she doesn't get defensive. She will listen to me, and then we can figure it out. And that's another thing that's very helpful, is she's willing to meet me halfway. And she also recognizes the complexities, because she deals with a lot of patients that have mitochondrial, because of that is it can affect the eyes. So she's familiar with the different presentations, and that a lot of times you may not be a textbook case, and she's talked about that. And so that is yet another thing that was helpful. And I don't know, there's just so many things, and
again, just that knowledge, right? And awareness. And it's funny because, I mean, to people listening, that this can sound like quite basic stuff, or things that may not mean that much, but to people like us, they make the biggest difference. It's truly neurodiversity affirming healthcare, right? It's allowing us to show up and be ourselves, and it's meeting us halfway, even if it's not what you're used to, expect, or want. And that comes down to not only your attitude and patience, and not taking away your judgment, being aware of your biases, but also education on knowing things like autistic people are more commonly going to have all of those problems. And, you know, being able to not just show up and say, I'm only going to treat you for this one thing, and I'm not going to even acknowledge all your other health problems or how they interact. Because the other thing to think about is like, this is sort of not quite a doctor's story, but I've obviously I don't know, I do a lot in the eating disorder world, and one of my recent dietitian, who has been the only one that's been really effective, she said to me once when I was saying to her, oh, I just need a meal plan so I can, you know, cook dinner 5 times a week. And she was like, why? and I love that question, why? Because I was saying that I needed that because I thought that was recovery, normal, or like, just there were so many reasons why I thought that was necessary. And I think that story shows that we do need to be questioning why, and we also need to be saying like, what if we do this, what else will it affect? So for instance, I have been able to cook from home, by the way, for many reasons, executive function, blah blah blah. I struggle to cook dinners, but anyway, not the point. I have figured out how to cook from home regularly, but when I did that, everything else in my life was a hot mess, and I couldn't work, and my whole life was just that. So yes, I can figure that out, and even if I get systems to make it easier, but there's also an aspect, and this is very much a neurodiversity affirming thing, like thought process of like, and this is where the disability aspect comes in. It's like, not what support and accessibility things do you need? Like, do we want to waste a lot of your energy and mental cognitive processing on this activity that causes you such fatigue and stress, versus can we put something in place like meal deliveries, or get a support worker to come and help you cook dinner or cook dinner for you, so that it helps other aspects of your life and health? And I think, like, I know this is not a doctor's example, but I think in healthcare settings this matters, because it's a matter of saying like, okay, you might, for example, have some knee pain, but maybe dealing with your back pain is more important. So when you're seeing the knee doctor, they need to be aware of the back pain, and also acknowledging the fact that, well, you're the client, you're the patient, and it's actually up to you to decide which one is affecting you worse and what you want to address. But it's up to them as the specialist to educate us to make an informed decision, right? So they need to not only be able to communicate everything that they know about it, but they also need to be helping us to understand the bigger picture and understand our different brains.
I agree with that. Yeah. Also, sometimes having co-occurring conditions can be the difference between whether something is a problem or not, because maybe something isn't a problem unless you have something else. Yes. Yeah, so on its own, I can think of so many stuff, but a quick example would be the autoimmune spine condition, because it can cause hip pain, and then that's where a lot of my muscle weakness from my muscle disease is. So it makes it more difficult, and that was something that I brought up to my doctor, and I think that eventually helped, because I did point out that, look, I have muscle weakness. If something's hurting, it's going to make it functionally weaker, because, you know, it's just harder at that point for anybody. Yeah. Yeah, you'll move less, and you'll lose like what muscle you have, because you're in pain. And weakness can cause it. It's all interconnected, but yeah, one thing that some of my doctors will do to kind of help, so they won't ignore multiple conditions, and this isn't, I'm finding myself needing this less, but sometimes a doctor will book one appointment for one set of things, and then a different appointment will be for something else. So this has happened for one thing that came to mind was back when I had some kidney issues. I was the kidney doctor for like electrolyte issues, and then I would see her at a different appointment for my kidney stones. And that helps sometimes, but I don't feel like it's always the solution for everyone. But also sometimes they will allow me to bring up the other problem if I remembered something in between the appointments, so that can help as well. That does help.
Yeah. And I think it also goes down back to what we were saying about writing a list. And I guess, for me, it's very much a matter of I just want to communicate everything that I'm experiencing because I don't know what links to what. And I've got historical evidence that
Right.
some things mean other things. And like, like it's for us, it's a matter of like, even if you don't know it on a, like, a conscious level, on an unconscious level, a lot of us have so many experiences in the health profession where we'll go in and find something wrong. Eventually they'll figure it out, but they'll
Right.
miss something else because of the overlap and because of the interconnectedness of symptoms and what's underlying the symptomology. And again, it's always about trying to figure out really what is underneath it. And I think the very first step in that is acknowledging that we are complex and you need to actually look, because if you've got a neurotypical white cis male in front of you and they have this symptom, it's probably going to be pretty simple to diagnose. But if you add any kind of complexity to that, you need to be aware that these things are what we experience and it is more complicated. And I'm not saying that they all need to know the answers necessarily. I'm just saying it's about attitude and acknowledging that they may not know the answers and then trying to figure that out, which so many of them, and I don't know why this is, but so many of them will just be like, oh no, I'm the expert, that's irrelevant or whatever. And then eventually we all work out when we do see the people who do understand it, like that doctor you were just talking about, and like a few of the specialists I've seen that have been wonderful have been like, yeah, no, it is definitely a thing and you shouldn't have been dismissed for that.
I agree with you on that. I feel like it's definitely complex though, and I feel like asking why, which I know you said, but if a doctor had asked me why, there's so many times where that simple one word, it could have helped so much. Like everything that's in like a miscommunication. I feel like if they'd asked me why, I could have explained it. So I don't know. There's so much to go over. It's impossible to cover it all. But if someone had asked me, why did you rate your pain on the scale this way, I could have said, because rating subjective symptoms is another common challenge I've heard for autistic people. And I've
yes.
Yeah. So being asked why could make a huge difference and has with me. But I don't know. I think curiosity helps.
Yeah. And even, the pain scale usually has like the faces on it and red and green. And then like the green one's all smiley and the red one's all like, I'm like, that's literally like a barrier in itself, because many of us don't have the same expressions that meet that pain level for us. But it doesn't mean we're not experiencing severe pain. Or not. Or in your case of depression, it doesn't mean you're unhappy just because you aren't smiling constantly and have that lack of expression.
Or try to find out if it's depression versus alexithymia, because I was
and if they'd have just asked you why,
maybe, and that would have been helpful instead of
you know,
prescribing me antidepressants. But
and just giving you the opportunity as a patient to have your voice heard and to maybe understanding how you're viewing it or you're experiencing it. And I even like the doctors that are like, well, I'm from A, B, and C that I'm noticing, I'm thinking that you might have this. What do you think? And then it's just letting us understand where their head is at and then being like, oh, I agree, or oh, I didn't think of that, or oh, I'm not sure that I agree because I'm doing this for this reason, or I do this and it's always misinterpreted, or there's also actually this that might be relevant to that diagnosis that I didn't really know you were thinking of, or like there's just so much in terms of being more direct and open in your communication style.
I know, at least in the US, and I suspect it's not very different for you, but feel free to correct me on that. But in the US, we hint a lot and we're subtle, and we may not always say exactly what we mean. And I know I will do this from time because everybody that I know does this, but it makes it really hard, especially with medical stuff. It's just really hard to find out what a doctor really means. And this actually goes back to what you were saying earlier. If a doctor had simply asked what they meant by "how are you," because that could mean how are you now, or how are you with your medical problems. So
exactly. Are you wanting me to give you a neurotypical answer when people say, how are you? And you're just supposed to say, yeah, I'm good. How are you? Thanks. Or do you want me to go into everything that brought me here today and exactly what I'm concerned about? Like, it's just not
yeah,
explicit. I always like talking about implicit versus explicit communication. And across, all areas, this helps in education and employment, but it's critical in healthcare because healthcare is the foundation. To have good health allows you to access education and employment. Without good health, you can't even do that. It is so critical that we really help the medical profession create more
great.
accessible practices, because without it, our community will just continue to have
Yeah.
these horrific
And
outcomes and really suffer.
is it okay if I just gonna say something real quick? So with yeah, it's just
Yeah,
there's
go
so
for
much
it,
to
and then we'll
cover,
wrap up.
but
I know, but everybody will be coming back. We'll be back on the 29th for the second half of this
yeah.
chat, if anyone
So
wants to check it
if
out
something isn't
as well. But you say what you're going to say, Larissa.
reacting in a way that's expected, and so this feels like common sense, but again, it's one of those simple things that could make a huge difference, and that is because that could have happened back with the bipolar misdiagnosis. I did not respond as expected to medications, so that was why I was having those really bad side effects. Is the amount of dose increase was not acceptable, and it was really higher than expected, so that should have been a warning sign to look into something else. But then also for medical conditions, if a patient's not acting in an expected way to a treatment, or not, or if it just seems contradictory to the syndrome in general, I feel like it would be a good idea to step back and pause and think, could there be something else going on? But a lot of times I think, doctors are just
100%.
under pressure with insurance, at least in the US. So it's complex, but
No, I agree that it's a really complex thing, but at the same time, you're so right. And even things like with the differences in medication, I've heard from a few different specialists who are actually understand this stuff properly, that for instance, a very, very low dose antidepressant can be really helpful for autistic people. But so many of us show up and get diagnosed with depression, whether or not we have it, and therefore get put on really high doses that give us all these side effects when all we needed was the lowest, even half dose. And I talked to so many people that have also experienced this. So I'm hearing it from the professionals that this is what they're seeing helps, but I'm also hearing it from our community. But at the same time, I'm sure there are autistic people that need much higher doses of whatever, who are hypersensitive to it. And this is where it's important to point out that we are all different, and we're different within our differences. And a lot of people talk about sensory needs. I am both hyper and hyposensitive to taste. And sound. I'm very sound sensitive, but at the same time, I'm sensory seeking in certain sounds. People don't really, when sensory differences, I notice in health dialogue and research, it's very much, they're sensitive to this, or they're hypo to that,
right, and they
or
don't
hyper to this, but it's actually
they don't
much more
always get the
complicated than
connection,
just being one or the other.
like simming with rocking with being vestibular or the inner balance system related. They don't see the connection with sensory seeking and simming behavior.
No. Yep. And getting us for me, I've been stimming this whole time. This is my little toy, one of them. You get to squish it, it's all magnetized balls. Anyway, but for me, this is it reduces my anxiety, it allows me to concentrate, and it connects me back to my body, which is so important from a anxiety perspective. Stimming helps us for so many different reasons. Some for just one of those reasons, some for all of them, and some for things that no one even connects.
Simple thing. When doctors taking history, they can allow patients to walk around or fidget or stim.
Yeah, allow them to move in a way that is comfortable for them. It's all about creating psychological safety and a sort of an environment of acceptance, really. I think essentially it's let us just exist as we need to exist in this world.
Yeah.
and meet us halfway, right? Anyway, we should close up, I'll just let people know we're going to be doing a second round of this, focusing a little bit more closely on mental health in autistic women and gender minorities. In Central Time, it'll be on the 29th of September at 7 p.m. and in Australian Eastern Standard Time, 10 a.m. Friday, the 30th of September for our international viewers. But this has been so much fun, and thank you so much, Larissa. I think we've highlighted some really important things for, both, autistic people self-advocating to know and anyone that's involved in their lives.
Thank you, Annie.
So
and
I really
I'm also
appreciate
excited about
having
the
this
collaboration
conversation.
between Princess and the Pea podcast and then Shine Like You Penny YouTube channel. But
Yes, definitely. Yes, yeah. This one we're going to be putting this up. It'll go on Princess and the Pea podcast, which is on most major platforms, in next week. And the next one we do is going to be live on Larissa's YouTube channel, Shine Lucky Penny. So yeah, come around, and we hope you've all enjoyed, and thanks for tuning in. Thanks for giving us questions and comments. We really appreciate it. And yeah, see you later. Have a good night. It's this. Bye.